So respected Tapan Kumar sir, Pawan Kumar sir, PM Madhu sir, and all the other dignitaries. I hope I am audible. I am going to share my screen.
Yes, you are audible, sir.
And the screen is visible.
Screen
sir.
is also
okay.
Screen is also visible, sir.
Okay. So once again, I thank the organizers for providing me an opportunity to express my views on the role of Ayurvedic diagnosis, especially in the practice of personalized medicine. So we all know that the concept of personalized medicine has been evolving recently at a more faster pace than previously it was thought. And even the new term is not personalized medicine as such, but they like to call it as precision medicine rather than personalized medicine. So let us look into what our approach is regarding this personalized or precision medicines. And also, I would like to explore whether there is any scope for any collaborative research and other modalities where we can integrate our systems and go forward for addressing the health issues. So that's what I'm going to do. So these are the contents: introduction, personalized medicine, then Ayurvedic markers for personalization, scope of future research, and conclusion. So the new trend in medicine. So what is a new trend in medicine? So the new trend is about precision medicine. So in the past, when we look at the history in the past, actually the practice of medicine was based mainly on intuitions. So it was an intuition based. Again, a lot of observations were there and intuitions were there, and the management were usually by a trial and error method, especially relying on the signs and symptoms in the patient. And at present, what happened is the trend is the evidence-based medicine, where a lot of evidence are being generated based on the clinical trials that are conducted, and the practice or the treatment is administered based on the best available evidence. And the future, as such, we cannot say it is future because we are already in the future, because a lot of these things are going on in the field of modern medicine. So the future is precision medicine, where the treatments are based on algorithms. And all these algorithms are developed based on subtle parameters elicited in the patient with regards to his genetic makeup, as well as other biomarkers available in relation to its genetic makeup and the disease pathology as well. So a combined approach of a precision diagnosis and personalized treatment is what is the future that is in store for us. And the precision medicine, actually, that the motto or the theme of precision medicine is the treatment targeted at each patient endotypes. Then, apart from patient endotypes, there are also disease phenotypes and endotypes. So, what are disease phenotypes? So, phenotypes are nothing but we know the genotype and phenotype, the explanations regarding that. So, a disease phenotype indicates that the diseases, even though caused by a same organism or a similar pathology, can have different traits in different patients. So this actually we Ayurvedic people we know very well because all our samhitas are elaborately dealing with all these phenotypes and endotypes. So phenotypes are observable characteristics or traits of a disease where there is no what you call implication of any underlying mechanism, but still there are differences in the presentations. And regarding the endotypes, again, it's a subtype of a condition which is defined by distinct functional or pathobiological mechanisms. So, for example, we can consider that suppose we take one disease, CASA, the dosha types can be considered as the endotype because there is some difference in the pathology. That is why a particular dosha is predominant in that disease at that given point of time. Then the phenotype, even in the given dosha predominance, for example, we take 3 patients with the Vadaja Jura, there will be subtle differences in the number of Vadaja features available in each of these patients. So these can be considered as phenotypes as well. So our treatment also varies depending upon these things. So modern medicine is also going into a similar direction where they also have started understanding the difference between different endotypes and phenotypes. So the personalized medicine is nothing but the tailoring of medical treatment to specific characteristics of each patient. And it also enables to classify individuals into subpopulations that are uniquely or disproportionately susceptible to a particular disease or responsive to a specific treatment. Ultimately, it's a form of medicine that uses information about a person's genes, proteins, and environment to prevent, diagnose, and treat diseases. So there are a lot of opinions regarding this term. Personalized medicine is not apt, and the term should be precision medicine. So whatever it may be, the concept is almost uniform. That is, every individuals have some variability within, and we know that it's the nature of living beings, and a same disease in different individuals will need different therapeutic measures to manage these patients. So that is a mode of personalized medicine, and there are so many terminologies associated with the personalized medicine, like pharmacogenomics, where the genetic analysis are being done, and especially that is done to identify which drug will be more beneficial in a particular genetic makeup. Then there are pharmacodiagnostics, again, identifying subtle markers and parameters in the patient in order to enable a better selection of the drug. So something called as a companion diagnostics, the field is evolving now. And then there are personalized biomolecular diagnostics, where again a lot of biomarkers regarding the diseases and other characteristics of individual are being mapped out. Then there is a very large field of omics studies, like genomics, transcriptomics, proteomics, etc. So all these things contribute to what you call the evolution of the branch of medicine known as personalized medicine or precision medicine. So this is an example, so that previously a one dose fits all strategy was followed by modern medicine, but now they also came to know that it's not like that. Sometimes some of the individuals are rapid metabolizers, whereas some of them are poor metabolizers. Then the dosage strategy also should be different in different individuals. So like that, not only regarding the metabolizers, other characteristics as well will decide how the treatment is going to be effective in a given individual. So if you look at Ayurveda, we are not at all astonished or wondered considering the evolution of this personalized or precision medicine, because right from our Samhita Kala, we have been practicing this personalized medicine. So we know that we do this Roga Pariksha and Rogi Pariksha, and based on the subtle changes that is available at your disposal, that means in the given patient, we are going to modify our treatment. Just like Tapan Kumar sir just now explained, the subtle differences in the selection of the drug when the dosha or the typical characteristics in the patient changes. So all these Dashavida Pariksha and the Vigara Pariksha, all these things are nothing but Ayurvedic way of making the treatment more precise. So the right drug, with the right dose at the right time to the right patient. That is the motto of precision medicine. So again, in Charaka Nidana, he says about uh, dwelling into the deeper aspects of the diagnosis, where we have to assess the vriddhi, sthana, akshaya, or even the avastha or the bala of deha, agni, manobala, then vyadhi avastha. Even in the same vyadhi, depending upon different avasthas, that medicine may change. So if you ask us, then the Ayurvedic way of personalization is more elaborate than the contemporary modern science. So what are the indicators in Ayurveda? So the markers or indicators can be classified into patient-centric markers and disease-centric markers. Because we are all well aware of all these parameters, I'm going to go a little bit faster through this. So patient-centric markers include his prakriti or the genetic makeup, then the body habitus, which includes the Sara, Samhana, and Pramana, then the Satmya or the dietary preferences, then the mental strength or Sattva, and the metabolic status like Agni and Koshta, then the Desha or habitat, especially where the patient was born and brought up, and the Vaya or the age of the patient. So what are the implications of these markers? These markers are important because with the help of these markers, we can identify the disease predispositions, or even we can make predictions regarding the outcome of this disease in a particular patient, or the prognosis. Then the ability of the body to tolerate the disease as well as the therapy that we are going to give. And even it will help us in the selecting the drug and dosing or optimizing the dosage to the patient, and also assessing the response to the therapy. So with all these parameters which are patient centric, we will get certain idea regarding what type of medicines or treatment is fit for this patient. So I'll give some examples to just to make the concept clear. So, for example, in Prakriti, why Prakriti is important? So, Prakriti, we know it is important for predicting disease uh, predispositions and disease outcomes, etc. But regarding prescriptions, what is the importance? For example, this is an illustration of a drug selection for a Kapha Vada predominant disease in all these Prakritis. Suppose the Prakriti is a Vada predominant Prakriti, then we may go for a Deshamula Kvada. If it is a Pitta predominant Prakriti, we may go for Panjadikta Kvada. And if it is a Kapha Pradhana Prakriti, we may go for Varanadi Kvada. So all these Kvadas are Vada Kaphara, but in different Prakritis we may have to, because suppose if we are going to give Varanadi Kvada in a Pitta Prakriti patient, then it may backfire. So like that, Prakriti is even important for prescribing the medicines. So this is another example of an adverse event that happened in a patient. So Upanaha was tried in a very Pitta predominant Prakriti, and obviously the results are there for you to see. So even the selection of external applications or other treatment modalities, there also we should have Prakriti in our mind when we diagnose. Then the body habitus. Again, a lot of decisions has to be made regarding the treatment selection, whether we have to go for Lankana or Brahmana, Shodhana or Shamana. The bala of the medicine that we have to select. So regarding whether we have to go for a Mrudu Aushada or Mrudu Shodhana, or we should go for a Tikshna type of medicines. So that is where the body habitus will come into play. Then the metabolic status. For example, this has a lot of implications, so that we can go and speak for hours regarding the importance of Agni and Kosha. But this is a simple illustration. For example, if you want to prescribe a Vada and Lomana drug in these respective Koshtas, so if in case of a Vada predominant Koshta, if the Agni Bala is poor, then we may go for Gandharva Hastadi Kvada. And if the Agni Bala is good, in a Vada predominant Koshta, we can go for Lesunadigrata. But in case of a Pitta Pradhana Koshta, we may go for Avipati Churna. And in good Agni Bala, we may go for Sugumaragrata. So based on the subtle changes that is going on in the patient and subtle indicators in the patient, it has very important implications on the drug selections. Then regarding the habitat or desha, where the ethnogeographical variability of drug response is very important. So Ayurveda has always stood for the concept that wherever the patient belongs, the medicines also, it is better to extract from those areas and give, because that is the most thing that is hida for that patient. So this concept of ethnogeographical variability of drug response has come to limelight even in modern medicine. And also we have to think about other parameters, like for example regional preferences. If you take Bengal and Kerala, then in Bengal they prefer mustard oil, but in Kerala we prefer coconut oil. So like this, regional preferences will also come into play when we select drugs. And then there are climatic influences as well on the drug, the potency of the drug, and even the response of the patient's body to particular drugs. So that is where this desha will come into play. Then regarding the age, again, it is very important for selection of the therapy or the drugs and the dosing strategies. And recent studies have validated this concept of the importance of age-related changes in pharmacokinetics. So obviously, our acharyas, whenever, even though their science was a purely observational one, they have given such what you call subtle thoughts into developing this personalizing strategies for our management. So that is regarding some of the important patient-centric markers. Then next is the disease-centric markers. So whenever we assess the disease, we go through a lot of the parameters like Hedu, Dosha, Dushya, Srodhas, and a lot of other parameters as well. So basically, what we do after applying these parameters is to categorize the disease based on its dosha predominance and even grading of the doshas. For example, if there are 2 or 3 doshas, then which dosha is Tara, which dosha is Tama. So we go for that grading, and even staging or typing of the disease, like it's an Ama Avastha, it's a Pakva Avastha, or a Pachyamana Avastha. So there are a lot of staging that is going on. And etiological considerations as well. For example, a Vada that got Pragupita due to a Ruksha Nidana, and in another patient, a Vada got Pragupita due to a Shida Nidana, then the treatment also will be different. So like that, even the etiology is also very important whenever we assess or analyze the disease in the given patient. So as I discussed earlier, the disease endotypes, maybe I'm not saying that this is final verdict, but this can be correlated in such a way that the disease endotypes may be dosha based classification, and the disease phenotypes may be the variations in the specific dosha lakshanas in a particular dosha predominant disease. So that is regarding this disease endotypes and phenotypes. So let us see some of the examples. For in case of a disease endotypes or dosha predominances, if we get 3 patients with a gastric ulcer diagnosed by endoscopy, all these 3 patients are diagnosed cases of gastric ulcer. But if the patient has pitta predominant manifestation like burning sensation or burning pain, then we may opt for Datri Loha. And sorry, pain predominant, we may opt for Datri Loha. If the patient has a burning predominant presentation, then we may go for Kamadudarasa. And if the patient has loss of appetite or dyspepsia, then we may go for Shankavadi. So even in the same disease, depending upon the endotypes or the phenotypic presentation of the disease, the drug selection varies. Then there are also important micro assessments regarding dosha. For example, we go for looking at the ratio of the dosha. So in case of a samsargaja kushta, in both cases the pitta and kapha are there, but in one case pitta is predominant than kapha, then we may opt for guduchi adi kwada. And if kapha is more than pitta, then we may go for padola adigana. So even such subtle differences will elicit variation in the prescription as far as a pure Ayurvedic approach is concerned. Then next is the fractionization of the doshas. For example, you take a case of Pakshagada or a Vadavyadi, and if the Ruksha Shida Nidana or Amsha is predominant in terms of Stamba and Sangoja, then we may opt for Kaya Sega as the treatment. But if the Laghu Ruksha factor of Vada is predominant, for example, if there is too much flaccidity, then we may go for Shashtika Pindasveda. So such subtle differences are also should be looked into for personalizing the treatment. No, so next is the relevance of the Nidana. What is the relevance of the etiology? Even in the same disease, if there are Nidanas are different, then the treatment also will be different. For example, these are 2 cases of hypothyroidism. So Mrs. A had Pitta Vada predominant presentation, and then the elicited Nidana included spicy and fried food habits. Then the drug selection will be basically Vada Pittahara or Pitta Vadahara in terms of Drakshadi Vada and Kalyana Grada. But in case of Mrs. B, where the Kapha Pitta predominant presentation was there, and there were history of curd intake and day sleep and all those Abhishandi Ahara Viharas, etc., then we may go for Tikta Kvada and Abhishandi Hara drugs like Triphala, Gugulu, etc. So even in the same conditions with the different Nidanas, the prescription will be different. So to wind up, this is a simple illustration of a process of personalization in Ayurveda as per Ayurvedic parameters. So suppose a patient came and we did a Roga Pariksha, and the Roga was Vada Vyadi, and the Dosha was Vada Kapha, and the Avastha was Nirama and Dhadu Gada Avastha, and in the Nidana it was Laghu Ruksha Nidana. And in case of Rogi Pariksha, the patient's Prakriti was Vada Kapha, Agni Madhyama, Satmya Madhyama, then Vaya Madhyama, and Adura Bala is also Madhyama. Then the therapeutic plan will be a Shamana Sneha with Gugula Tikta Grida in Madhyama dosage. So based on each of these parameters, ultimately the personalized medicine will come in the form of a particular drug. And when we give such a drug, then there will not be any late therapeutic response as we see in our practice. So what are the scopes for future research? So with these things, the next question is, okay, we have all these factors that are intended at a personalization. The next thing is how we can develop upon our strengths. So the first thing is what we can do is to go for pitch for collaborative research with that of scientists in the modern field. So patient-centric biomarkers for parameters like Prakriti, Agni, cost, etc. has to be probed into, because we know even in Prakriti, we know that now all these genomic studies have raised the possibility of a what you call validation of the concept of Prakriti. So I think we should go for identifying these markers or genomics regarding particular cost and other parameters as well. then that will aid us to identify more easily in these patients. Next is to explore more into the scope of these omic studies in Ayurvedic markers. So we have all these markers like Agni, etc., etc. So what about these omic studies in all these? For example, if there is any change in the proteomics of a good Agni patient, or a Pitta predominant Agni patient and a Vata predominant Agni person. So like that, we have to explore more into that field as well. And also we have to explore regarding to identify typical markers for certain disease stagings like dosha predominance, amavastha, etc. We have to explore for the possibility of identifying such markers as well. And another angle to this is whether we can collaborate in such a way that where there is an integrated approach. For example, for these modern drugs, for example, take paracetamol. Paracetamol is good for such prakriti individual, and it is not good for such and such prakriti individual. So like that, whether we can develop prakriti based markers for drugs in biomedicine as well. So we can also direct our researchers at that level as well. So these are some of my suggestions. And to conclude, this is what I have to conclude. Ayurvedic parameters for personalization are more elaborate than the current biomedical models. And employing Ayurvedic diagnostic methods is indispensable for a targeted therapy. So what happened recently is whenever we started following this modern medicine, even Ayurvedic people got tuned into a typical disease and typical medicines. So it is not like that. Even when our Samhitas were written, Acharyas intended to highly personalize the therapy. So that is why they gave us a lot of medicines. For example, our pharmacology is very elaborate. If you take our Vaishya Ratnavali, we have thousands and thousands of yogas. So why those yogas came into existence is because of all these, what you call the importance of this personalization. And finally, what we can say is that the collaborative research can pave way for further advancement in the field of precision medicine. So I thank all of you for your patient listening. I hope that I have not overshot the time limit. Thank you once again.